Oh, you're going to start.
All right, thank you everyone for joining us today for this community conversation regarding how we are going back to operations for the remainder of winter quarter. You all received messages yesterday from Anamare and Mark Richards, and also from the Chancellor and from Ali and Mentha. And thank you for being here to ask questions and have a conversation and discussion about how we can move forward. So the format for this meeting, those of us on the panel are here in the room. You are all on YouTube. You can send questions to uwttownhall@uw.edu. I'll be kind of taking these as the meeting goes on. I've got a few to start with, but that's how we will proceed. And I'll follow up with those questions if we don't get to them during this time, or you send them tomorrow, or are watching this later and have a question that comes up. Please feel free to send a question to that email, and I will make sure to get back to you. So I'd like to introduce our participants. With us today, we have Vice Chancellor Van Smiley, Vice Chancellor for Finance and Administration. We have Vice Chancellor Mentha Hines-Wilson from Student Affairs. Interim Executive Vice Chancellor Ali Medeiros from Student Affairs, and we have our Chancellor Sheila Edwards-Lang. We like to start our meetings with the land acknowledgement, so I'd like to do that now. So we recognize that all of us at UW-Tacoma learn, live, and work on or near the ancestral homeland of the Coast Salish people. In particular, we're situated on the traditional territory of the Puyallup. As people on this occupied territory, we have a responsibility to acknowledge the land, the ancestors who have cared for the land since time immemorial, and all our indigenous connections today. We also have the responsibility to acknowledge the histories of dispossession and forced removal that have allowed for the growth and survival of this institution. In light of this history, let us take active efforts to partner with our indigenous community members and neighbors as we continue our work together as a community of learners, leaders, and educators. Thank you. So at this point, I'd like to turn the microphone over to our Chancellor, Dr. Sheila Edwards-Lang, with a few opening statements, and then I'll go right to your questions.
Great, thanks, Joe. Thanks, everyone, for tuning in. I want to just emphasize that the purpose of today's meeting is to hear from folks, but also to think about how we as a community move back towards mostly in-person operations. As we were debating last week and looking at data and looking at numbers, Vice Chancellor, both Vice Chancellors for Student Affairs and Instruction, Academic Affairs, and I were part of a tri-campus group that looked at all the data, that talked about what we should do. And I want to make sure that folks know that we recognize that the Pierce County numbers are different than King and Snohomish County. But overall in Washington, the projections from the Institute for Health Metrics is that we are on the downward slope for the Omicron surge. And so that played a large part in the decision making. But the other things that went into making the decision were sort of local and university case counts, and we do have a dashboard that anyone can look at to see, and you'll see that the numbers compared to where we were in December when we made the decision to go to remote instruction is down. We looked at UW Medicine hospital case counts and positivity rates, And we looked at reports of on-campus transmission. And we have been really fortunate thus far at the University of Washington to not have large-scale on-campus transmission as detected by environmental health and safety. And then we looked at the operational constraints, both here at Tacoma, but also at Seattle and Bothell, that were happening as a result of K-12, what was happening in K-12, what was happening in childcare. And we made the decision to go back to mostly in-person operations with a lot of flexibility. And I think that's the thing that I want folks to leave here understanding, that we are offering maximum flexibility. So we've gotten some concerns from folks saying, well, you know, I have childcare issues, my daycare has closed. We're asking supervisors to work with employees to make sure that those folks then have flexibility to stay home if that's what they need to do. If you have if you're immune compromised, and I'll tell you all, I'm immune compromised. So if you're immune compromised and you're afraid for getting it, then figure out a way with your supervisor or your dean to change the modality of your class or to stay home. So we're not saying that it has to be an absolute for everyone to come back. We are trying to make sure that as we are coming back, we are keeping people safe and understanding the different life circumstances that everyone has during this virus. But we are moving towards a point where we are going to have to live with COVID-19. It is not going away. We are entering year 3 here, and so what we are trying to do is transition, not only as a university, but as a community, to how do we live with this? How do we move forward? How do we keep people safe? But how do we move forward and begin to live fully again? So we're here to answer questions and hear your thoughts about and concerns that you might have as we are trying to move forward, understanding that we are also trying to be as flexible as possible, more so here on the Tacoma campus because we recognize that we have lower vaccination rates here in Pierce County. So one of the first questions, should I just jump into it, was really understanding the Pierce County case counts and understanding that Pierce County, in terms of the surge, is a week behind, a few days to a week. And so this is the thing with projections. They say a few days to a week. What does that mean? Behind King County. We're looking at this state, and if you look at today, we're on the downward slope in Washington State. And that's the same for King and for Pierce. So while we may be a few days to a week behind, everyone in Washington State is on the downward slope for the Omicron, for this latest surge. And do you have additional data from Pierce County?
Good morning, everyone. There is information coming from Pierce County, and this is a message that's dated a couple of days ago, but I'm quoting, and it says, "We have early evidence that the wave has peaked. Cases are likely to level off soon. Still, our cases are among the highest we've seen. The expectation, we expect hospitalizations and deaths will continue to increase in the weeks ahead because they usually lag behind case counts. However, Pierce County is cautiously optimistic that the surge has peaked." And this information can be found on the Pierce County Public Health website. And as Chancellor Lang mentioned, there is conversation on a daily basis between the IMAC folks and the Incident Command at UW Tacoma. And so we're looking at data, or they're looking at data across the entire state. And right now, we're in a really good space.
Great.
Okay, I'm going to ask the first question. And some of these questions I'll be kind of grouping into groupings because they come in and they're kind of very similar. So we don't want to kind of dwell on the same topic, so I'll be grouping them. But this one's from a student who's concerned about living with an at-risk family member and says, "I don't feel safe exposing them, especially by being in classrooms that don't allow 6+ feet of distance from other students." So how can a student like that risk bringing Omicron home to an at-risk family member?
Definitely can appreciate the concern, and we want everyone to take their appropriate precautions. In this instance, I would encourage you to have a conversation first with your faculty member, but at the same time, there's the opportunity for an individual to connect with the Office of Disability Resource Services, and there could be some level of accommodation that's made available. But at the end of the day, I think this is an opportunity for the student to be in conversation with the faculty member. Let me also say that at this juncture, we have no evidence of in-classroom transmission. So we are finding that students, and I should step back and say, students, I really, really want to thank you for all that you have been doing thus far to be incredibly compliant. As I walk around the campus, and when the campus was much more active in the fall, we saw students were wearing their masks, faculty were wearing a mask, people were being mindful of social distancing requirements. So we know that there is the way to navigate in that space and to do so safely. So again, I think this is one of those situations, talk with the instructor, get a sense of how you can indeed protect yourself in that regard, have a conversation with DRS, but also be assured that your classmates would be, I think, supportive in the ways that they're trying to protect themselves as well as protecting you.
You want to add anything to the fact?
Well, I think the issue that has to be emphasized is talking to your faculty and letting your faculty know that's where you start. And then after that, it's interaction with university services that provides the kind of support that you need to make sure that you're both participating but also protecting yourself and your family members. But it is good to have a dialogue around that, so do come and talk to your faculty members about that one.
And I would want to add that the same is true for employees. If you live with an elderly parent or with someone who is immunocompromised, you can always have a conversation with your supervisor and with HR, and we are doing accommodations.
Yeah, exactly. And since the question is from students and now we talked about staff, the same applies for faculty. If there is a faculty member who feels uncomfortable because of the immunocompromise themselves or the members of family or childcare or any issues that relate to that, the idea of maximum flexibility is that you can actually change or keep your class mode as remote if that's the format that it works. The thing that we are asking you is that you interact with your dean, let your dean know, but more importantly also let your students know what you will be doing starting January 31st.
Okay, I'd like to remind you, if you have questions, please send them into uwttownhall@uw.edu. Next question is, my concern is that many instructors will not offer any materials remotely, so exposed students or even students with known infection will attend class as to not miss the material. Exposing other students. Could instructors be required to offer class recordings or lecture notes so that students who are exposed and positive will not expose others because missing class would be detrimental?
Okay, so before we answer that, I just want to make sure that you all heard what Mentha said earlier. We have no evidence of in-class transmission at the University of Washington. So we went fall quarter, in person, and we have not had that. So, but having said that we don't have evidence of in-class transmission, there are things that
They can
I'm
do,
sure
yeah.
we can do.
So just to be clear, what we are telling faculty, and students need to know that as well, is that we are not asking faculty to do simultaneously both in-person and synchronous classes. However, asynchronous, meaning materials left on Canvas or materials for educational purposes, can be made available to students, and we ask faculty to work with those students who have that need. I'm sure most faculty members would consider that issue, how to support students who cannot attend. It would be the same as when we were in person. If there was a student who was sick for an extended period of time, they would talk to their faculty and create ask for specific kinds of accommodation. They would talk to university to ask for specific accommodations. Is the same thing. The thing that we are not going to ask is the idea of synchronous. So the element that should be understood is that some faculty members also put their materials or they do their classes as panopto and they make that recording available when necessary. Please talk to your faculty, and your faculty would provide you with the instructions about how to access the materials for their classes when you cannot attend.
And if I may, I just want to reiterate that if you are ill, please do not come to campus.
Exactly.
If you are sick, stay home. Be in contact with the appropriate individuals to report that you are ill, but do not come to campus. As I mentioned a moment ago, we are a community that cares. We are a community, we use this expression at Huskies, travel in packs. We look out for each other, and in doing so, you're protecting yourself and your fellow classmates. So I want to stress, if you are ill, if you are experiencing symptoms, make it known to us so that we can make sure you have the appropriate support, but do not come to campus.
Okay, okay, next question. Will hybrid remote schedules for staff be allowed to be implemented spring quarter and beyond as a regular part of our work schedule? I've heard that many staff are waiting to see if this is ongoing before looking elsewhere for employment.
Well, I think we don't know what's coming, and that has been probably one of the greatest frustrations during this pandemic, is we don't know what's coming next. And so right now, faculty members are putting forward what their plans are for spring quarter, and we hope we can stick to that. So if a faculty member is saying they're going to teach a hybrid course, that's the way it's going to be offered in spring. There will be some faculty members who will offer fully online. They are working through all of those things now. So the idea in spring is to continue what we're doing now, to stay open as much as possible in person, and to accommodate staff flexibility as the community situation warrants, meaning as the case counts are being monitored. If we have community spread, what's happening with K-12, what's happening with daycare, because that's a huge part of why so many folks are needing flexibility. Daycares are closing. K-12 classrooms are closing unexpectedly because people have to quarantine. And so just being mindful and respectful of that. So everyone has telework agreements in place, but what we're saying is you don't need to modify that while we're in this surge and trying to figure out, how we respond to what's happening out in the community.
And Sheila, I would just add that as per yesterday's messages, to me, the word that struck a chord with me is being empowered. Leaders and supervisors are empowered to make decisions in order to facilitate and accommodate staff and in their individual circumstances. And should you be in a position where you don't feel like that's the case, please escalate. But that is the culture we're trying to get throughout the community, is to support staff, students, and faculty so that we demonstrate unity of effort in accomplishing our campus's mission.
Yeah.
And I want to emphasize that if someone feels like they are not being heard, or that their supervisor or their faculty member is not hearing them, please go to the dean if you're a student. If you're in one of the primary areas, elevate it if you feel like you're not getting the flexibility and support you need to keep yourself and your family safe.
Yeah. The key words are flexibility and empathy simultaneously, and with the focus on what universities are supposed to do in terms of delivering education.
All right, here's one. I think Ali can answer this one. How come UWT cannot make independent decisions concerning COVID operations, such as when to return to in-person instruction, with Pierce County lagging in the decline of COVID cases, like it took independent decision-making concerning snow conditions that were to suspend operations at UWT? So why can't we do our own thing?
That is exactly what we are doing right now.
Exactly.
So I just want to emphasize that we were part of the tri-campus conversation. We talked about how Tacoma is different than Bothell and Seattle, and we're given the flexibility to come back and say, okay, given where we're going, knowing what the data is from IMHE, and that the surge is projected to be over, the worst of it, and then how do we come back to Tacoma and implement local decision-making and local flexibility to keep our folks safe?
Yeah.
And just one more comment about that. I think there is this misnomer about who's making the decisions and how this is coming down. This is indeed, from March 2020 until now, There are daily conversations, and there is always a representative from the University of Washington, Tacoma in those spaces. There have been some conversations that have looked at academic matters, so there was a representative, the EVCAA served in that space. There were conversations that looked more globally, in which the chancellor and the board of deans were involved. There were conversations that talked about student life. So just want to, and there's been staff representation, and there's been student representation. I am a vice chancellor, but I am also a staff person. That's my identity. I identify as a staff person. So in terms of conversations happening about the impact for the University of Washington tri-campus, conversations daily, looking at data, conferring with Pierce County, King County, other individuals, and then again, at the end of the day, coming back and thinking about what that looks like and what that means for this campus.
I will also just emphasize that we are not an independent university. We are a tri-campus university. So we make decisions as a tri-campus, and I think that with me as a new chancellor, the chancellor at Bothell, and the president and provost, we are committed to tri-campus decision-making.
So next question is, will UW require KN95 masks, and will they be provided?
So we
Who
are
wants to
not
take
going
that?
to require them.
Yeah.
The university is not requiring KN95 mask. We do have a on-hand capability of surgical mask should you come to campus and not be masked or not have a mask available. One thing that I want to echo that Mentha brought up earlier is on our campus, it's been amazing when you think about mask compliance overall, going back to the fall quarter and into the winter quarter, that has not been a problem here. So we do not see a need to have to provide KN95 masks to every person, and it would not be sustainable over time. If there are individual circumstances that necessitate a KN95 mask, please surface that, and then we'll take that up here.
Okay, I think we've covered this one, but if there's anything more to say, if King County hospitals are overwhelmed, according to news reports, why isn't that enough to cause UW to delay its shift to in-person instruction?
Because that's only one factor,
Right.
and that we looked at. So I think a lot of the being overwhelmed is because people are short-staffed, because folks are out, either because of illness themselves or because of childcare and family issues. So that was only one of the factors that went into the decision-making.
So what are students supposed to do if faculty and or offices are not responsive to individual needs after making attempts to talk?
At that point, they can elevate it. They can send it to the higher level in terms of addressing their concern. However, we do want students to be working with their faculty and their respective deans before they elevate it to that level.
And let me qualify, responsive doesn't necessarily mean agreement. So the individual could be responsive and you may not agree with what the outcome is. So please be mindful of the fact that there are a number of individuals that really are working to be supportive and in service of students and want students to be successful. There will come in students, you've heard me say this on multiple occasions, there will be an occasion where I make a decision that you all don't like or don't agree with. And in that space, we can agree to disagree. But I will never, ever put you in harm's way. So again, there are offices and departments and instructors and so forth that are working to be responsive, but be mindful of the fact that sometimes that response may not agree with what you want. It may not line up with what you think is the way to go.
And then I would add that I know for finance administration and all the other support apparatus on the campus, the chancellor's focus is for us is to ensure that our services are accessible and available. If you feel like that service isn't accessible or available, again, escalate. And if it's something within the finance and administration division, please feel free to contact me directly if for some reason your customer service success experience isn't going the way you want. I'd love to hear about that.
And one of the things that we are going to do, and I think we had this here at UWT when the pandemic first started, was putting on our website and keeping it updated what offices are open when, and how you can get service when that office is closed. recognizing that we're not able to keep everything open because we have large-scale folks who are dealing with daycare, childcare issues, and illness. So we are going to do everything possible to keep offices open for student services. But when they're not open, you should be able to look on the website, see when they will be open, and how you can access services.
Mm-hmm. Student services are continuing to operate, so there's a combination of things happening across the campus. Most of the offices are offering some level of online remote opportunities. Then there's some offices that are offering a hybrid. And so you should always find an office that's being responsive and available when you reach out to them. If that is not the case, we need to know about that so we can make some adjustments. The libraries are still open, are continuing to be open. Computer labs are open. There's ample study space over in the mattress factory. It was interesting for me to see students on the first floor, second floor, and third floor. And there are all these little nooks too across the campus. If a student is looking for a private space to study, or perhaps you need a place to set up your laptop and engage quietly in remote instruction and learning, there are spaces in which you can learn about online. It's called Scout. It's an online tool. You can type into Scout and find out what spaces are available. So services open, as the Chancellor said. If it's not open, escalate that so we can do some research. But also know that there's been a whole lot of effort to make things as open as possible and readily available via the website.
I would add that when the Chancellor opened, one of the comments that she made is we're moving into that phase where we have to recognize that we're going to live with this. We've been at this for coming up on 2 years now, but that does not suggest that we all have a corner on the market on how to do things right. So it's one thing to ask questions, but I'm also interested in solutions. If you have recommendations in how we can adjust, how we do our business, please send those in. Because as far as I'm concerned, COVID doesn't pick a demographic. It just doesn't affect students. It just doesn't affect faculty. It doesn't affect staff. It affects everybody. So everyone is under duress, and we must continue to give grace and understand that across all of our population.
All right, the next question is from a faculty member. If one of my students tells me they tested positive, should I report this to someone at UWT? So I'll take a crack at answering that first, which is there is an extremely valuable flowchart around if someone tests positive, if they had close contact, if they've got symptoms, and it helps walk you through. I've used it personally. It helps walk you through what to do in what situations. It is at tacoma.uw.edu/COVID flowchart. And I will put that link and a lot of other links and information in the follow-up from this event. We'll be doing a Tacoma Together issue in the next period of time, day or so, that you will get, that will have that link and other links. We'll be reviving the page showing how to access services. I anticipate that those things will change regularly due to having to be flexible to meet everyone's needs. So all of those resources will be in that follow-up piece. So any other comments on how to respond if a student reports a positive COVID test?
Well, I don't know what else to say other than the fact that you probably want to have that flow chart in front of you so you know exactly what to do. Anticipate that this might happen, as opposed to when it happens, I'll look it up and have it on your desk. So at least for foreseeable future, while we live with this virus, you know what the next steps are always.
And I want to thank everyone that has reported thus far. That's how we are learning about student illness and student transmission. So when an individual does notify you that they have tested positive, as Joe said, there's a very involved flow chart. So you send a message to that particular email address, and that then invites us in to reach out to the student, gather information, and provide them with all the support that they need. The same is true for a staff person. So if a staff person reports that they have tested positive, there is a reporting mechanism, that information is gathered, and then again, there are a series of things that happen after that. So very much appreciative of those reports that have come in thus far. I would invite everyone at some point to take a look at the University of Washington COVID dashboard. That way you're able to see the numbers of students that have been impacted, staff and faculty. And you're also able to look at across the tri-campuses, and you will see of the three, we tend to be on the lower end in terms of cases, case counts.
So, and a related question to that, if a student tells me they have tested positive after regularly coming to class, should I notify someone?
Yes,
Is that the
answer
same
is
Yes, you should.
Yes.
That was easy.
So, and do we have particular, who should they call? What should they do?
Well, I want to refer everyone to the flowchart, so that way they're familiar with the entire process versus offering an email address or something. That's one. Whenever you become aware of a positive count, we do want to know that information so we can go back, if appropriate, to do contact tracing and see if there's a need for us to do ample notification. That's the other thing in the flowchart. It does indeed identify when to notify and who to notify. So please, please take the time to look at that. Faculty members, instructors have conversations with the deans. The deans have been very thoughtful in thinking about what that means in their respective areas and the ways in which they want to be responsive to that area. There's a very involved process involving student affairs and our team and how we respond, but the flow chart is your first go-to. Then from there, have a conversation amongst your peers, and if you need additional information or clarification, deans and others are available to do that for you and with you.
And it also includes what you should do in terms of should you go and get tested yourself and how that works, because I've used it myself as well.
So I've gotten a fair number of questions. I'm going to wrap them all into one about masks. People are concerned about the availability of KN95s, N95s, KF94s, basically a safer mask. What will we be doing? Yeah, I'm trying to wrap all of these questions into one. What will we be doing about helping to make around availability of those?
So the question was asked about availability. The University of Washington, Seattle, the main campus, is working to provide a number of KN95 masks available. We don't have a timeline. We also don't have any information yet around size and fit. The KN95, the structure of the mask, if you don't get the appropriate sizes, it may not fit correctly. So what we do have available is we do have the surgical masks that we can make available. There are some places in campus where I see them, but again, our campus in general has been pretty mask compliant. What we can do is we do have a limited on-hand stock of KN95 masks that if the circumstance warrant it, you feel you need a mask, we can provide that. However, we do not have a stock that's sustainable over time at the moment. Once we get more data out of the University of Washington, Seattle, on the main campus about the posture of KN95 masks, then we'll come back to you. But that's where we are as of today.
Yeah.
But we do have the ability to equip the campus and backfill surgical masks so that people have the appropriate mask to attend class and be on campus.
And some of that is being driven by what the state and the federal government are doing in terms of making masks more widely available. And so the Biden administration has increased the number of mass production using the legislation that allows them to turn factories into things that we need. And so mass production, test production, increased test production and mask is definitely on the agenda for the Biden administration. And then that is also at Washington State. The governor is trying to see how many more masks he can get and how those can be distributed out to the general public.
And Sheila, we are in coordination with the Pierce County Health Department when it comes to that particular position with masks. So it's not that we're not coordinating, we just have to coordinate like everyone else does as a part of local government.
But I do want people to hear we're not going to have the capacity to provide everyone with KN95 masks. It's just not going to happen.
So we've heard that there has been no evidence of classroom transmission of the virus. Is there evidence of transmission within the staff offices on campus? And how are infection rates with staff working in person?
So I'm not trying to answer that. I do know that there have been people in some offices who have gotten, who've tested positive. I know, that has happened, but I don't know the rate at which that has happened.
Right, so I think, of course, we're all being impacted by COVID, so it's not going to be uncommon for a staff person to test positive and another staff person to test positive. We have a lot of staff who socialize outside of the university, and so they're in contact with each other in that regard. Again, we can look into this, and I can delve into the details. I've not tracked that. You know, I've been looking much more closely at the impact for students. But for staff, I'm not aware of anything of that nature. What I do know is that when there is indeed a situation of close contact, there are these appropriate notifications that will go out. So folks will know and then be encouraged to be tested and what the response ought to be in that regard. So Joe and I will put our heads together. We will look a little more closely at the data and provide that information out in another venue.
So what about testing? So we've talked about masks. Now let's talk about testing and availability of testing. Have you heard anything about more availability for our students, staff, and faculty?
Great question. There is availability through the HCT program. So if you're not connected through the Husky Corona testing program, that is an option. They make available their information Monday through Saturday up at the Y. And so that's one approach. Also, there are a handful of individuals that received an exemption, and so those folks have already begun the testing process too. They are being tested on a weekly basis and submitting their information into environmental health sciences and our services and also Hall Health to make sure that they are compliant with the current guidelines and recommendations. But at this juncture, we're not hearing that our community is having difficulty getting testing. If indeed you do need a test and you have some concerns, feel free to reach out to me or to Joe. We can guide you appropriately. But I would say the main takeaway is HCT over at the UWY. There is indeed plenty of testing options available through them.
And testing is also being made more widely available by the federal government and by the state. So if you have not signed up for the 4 free tests that are coming from the federal government, I strongly encourage people to do that. I know that Washington State was going to send, I forgot the number of tests to people who requested them, and they have run out temporarily at the state level. So there's definitely a lot more testing sites that are being stood up. So there's a new testing site in Spanaway that does offer the rapid test. And there are a lot more places being offered in the community to do testing as well.
Okay, a couple of questions about money. Will you be giving hazardous pay to teachers and staff? And related question, is the campus losing money if we stay online?
So no, we will not be giving hazard pay. So that I think we're 2 years into this, and one of the things that comes up is if we are going to be living with COVID, and that is what every indicator shows, that we are going towards what we call endemic rather than pandemic, meaning you just live with it and it occurs naturally like the flu every year. We are not going to be able to sustain long-term hazard pay. It's just the way that we're going to be living with COVID. So there's no hazard pay coming. No, the university is not losing money by being online. I think that we are losing students, and students are not everybody learns well online. There are some students for whom they prefer the hands-on, in-person learning. They learn better that way. And we are seeing that those students who are not thriving in the online environment are dropping out.
Yeah.
So this is.
Can I
Go ahead.
make a general comment about this? I think some of the comments that we hear and the questions that I've heard since yesterday seems to emphasize that those individuals are reading the in-person portion. They're not looking at the flexibility portion of the message. And it is really important to realize that we are talking about faculty and their deans and students and faculty and managers and their staff to be flexible with each other. We are all trying to learn how to live with the virus. So I'm going to repeat what Van said. The issue is that how do we move forward collectively as a community? how do we talk about solutions that we can use? And I want to emphasize one other thing about the message. The message says that we are largely we're trying to get to in-person. However, we are not suggesting that everybody should be in person. We are providing that opportunity for faculty, students, staff to really be in conversation about what is best for everyone to move forward. So the question of hazard pay comes if somebody was being forced to get back to the class. The idea is that what are we going to do for the remainder of winter? And as you heard, we are in the kind of environment that we can't even make a decision for a year from now or a quarter from now. We'll be making decisions based on health, safety, and well-being of our community. And that's how we need to be thinking about as we move forward.
You know, one of the things you just reminded me, Ali, that we said largely returning to in-person operations. We have not been 100% in-person instruction since this virus began. So even as we were coming back in the fall, we were still partially in person. Most of our classes are still hybrid and online. So it's just important to note that we are not 100% back to in-person instruction. Neither are any four-year universities in the state. But what every four-year university in this state has done is what we are doing, coming back to largely in-person operations and trying to get there. So the University of Washington is not an outlier. We actually would be the outlier if we did not come back to largely in-person operations. And if you look at other four-year universities, the regionals, they are all back.
Yeah.
Some of them never stopped.
So how many people are currently out due to COVID for the last 3 months?
Oh, we don't have that data.
We don't have how many people are out. We have case counts on the UW
Dashboard.
the dashboard. I would say on that dashboard, my recollection, and you can break it down by Tacoma, and the case counts historically were down in the 6-8 range. I
Do you
believe
have a
it.
number?
I want to say, this looks like she's looking it up. I want to say this morning I thought it was 32. But I could be wrong. But it's somewhere.
We can look that number up,
Yeah.
and folks can actually look that number up themselves too on the COVID. The UW has a COVID dashboard where you can look by campus and see what the case count is all through this pandemic. So there's data, weekly data that is there for folks to look at.
Yes, I did have the data up a moment ago, but I really do want folks to get in a habit of looking at it for themselves. So the University of Washington COVID dashboard, and it allows you to look at all the campuses collectively, then individually you can sort that information. And so their information is self-reported, and it's also collected based upon the positive results from HCT. So that's how we're gathering a lot of our information. I was reminded as I was sitting and thinking about the question earlier, I am aware of one particular department at the early stages of the pandemic where there was a cluster. So there were more than 2 individuals that were infected, but again, that transmission didn't happen between the individuals, it happened in a different setting, but they happened to work in the same department. So I just wanted to offer that as one example. But again, not aware of any situation in which staff-to-staff transmission has happened, or student to faculty, or reverse.
So a question about the definition of maximum flexibility. Who has this flexibility? The school deans, the individual faculty in terms of how they run their course, students meeting the expectations of the course. So just want to hear some more about what we mean by that.
Well, if I have to break it down, I will. So maximum flexibility means that faculty think about what is best in terms of their pedagogical mode and what it is, what works best for them in terms of health and safety, considering their family situation. The next level is the dean's flexibility to work with their faculty and make sure that the faculty feel safe and feel comfortable in what they're doing. Those who want to be in person, that's fine. Those who want to be remote, that's fine if I have to just sort of go out and say it. And in terms of students, flexibility means that if your class is in person and you have health issues or you have family member issues that impacts your ability to be in person. You want to be in conversation with your faculty, which means your faculty need to be also be flexible with you. So what we are talking about, again, I'm going to go back to this. Flexibility is a multi-directional element here. And what is important in this process is that in all decisions that we make, we think of the fact that I think Van or Mentha said that all of us are impacted by this virus. It's not just one person or one group of people impacted. So maximum flexibility essentially means decision-making that involves our constituents, with the idea that we deliver on the mission of our campus.
Anything else we want to add on flexibility? I think it is, yes. I will say we are not, when I said we were, not 100% in person, we are working towards becoming mostly in person, largely in person. So that means flexibility with staff in terms of understanding life circumstances. People have to be healthy and well in order to come to work or work remotely. And so trying to make sure that we are doing everything we can to allow people to live their lives and attend to the issues that get in the way of them working in person.
So this next question is really kind of forward-looking, and it says, it seems as if the need for services, both academically and administratively, have changed dramatically post-pandemic. I do get the return to campus mantra. However, do you plan to evaluate how to provide services both virtually and in person, particularly for smaller offices? And how do you plan to continue evaluating needs for the entire campus moving forward, both academically and administratively? It seems as if some students, faculty, staff prefer online, while others prefer hybrid or in person. How do we plan to serve everyone with this divide? I would actually call it this difference moving forward.
I think we've learned some really important things during this pandemic. One is that we can do things differently and still get the same positive outcome for our students. For example, the live chat function is something that I think every university has found really helpful. It's a way that we can continue to answer questions immediately and provide folks with answers. Librarians have done just an excellent job of pivoting how they provide support to students remotely and in person. And I think we learned lessons that as we go forward, we know we're going to be sort of in this hybrid mode going forward as a university. We were not offering a lot of hybrid courses or online options as a university. I think every university in the country has learned that we're going to be offering many more hybrid courses on a go-forward basis. And it's just, students prefer, they prefer that mix of both in-person and remote learning. So we have learned some lessons. There are some things that have changed the university forever in terms of how we go forward, but it hasn't changed our mission of being an in-person institution. So we are not shifting to become a fully online university like Northeastern is here or WGU. So that is not our mission, that's not our model, but we will be offering more hybrid, we'll be offering more remote student services, and we'll continue to have this sort of mix as we go forward.
If I could add to it, before pandemic, the number of online and hybrid classes was sort of small. One of the outcomes of the pandemic is the fact that more and more faculty members have got comfortable with it, and there will be probably, even after the pandemic, when it becomes endemic, there's a high likelihood that we're going to have more online classes than we did before the pandemic. We also have learned more, to continue what Chancellor mentioned. For example, students' interaction during faculty hours with their faculty members remotely seems to have more of a positive outcome. From what I'm told, students are more likely to reach out to their faculty during faculty hours if they're remote. So we are learning things also that after the pandemic is over and we move to endemic sessions, or a portion of this, dealing with this virus, is that we are going to inherit some of that. We're going to continue with some of those practices. So when we talk about gradually getting to the idea of in-person campus, We want to make sure that what we learn in this period that works for all of us in terms of better outcomes, that they're not tossed out either. So we are going into this with as an institution of higher learning, we're learning from this as how exactly we could do better even after the pandemic is over and we get to the endemic period.
And I would say that all of the higher ed associations and organizations across the country are trying to share best practices of what we've learned and replicate those that were good and minimize those that were not so good. As I said, there are some students who are not thriving in this online environment.
That's true. So I've got a question, Allie. There's kind of a fair amount of faculty wanting more clarity around and really a kind of a public clarification of faculty expectations for accommodating students for long-term requests to engage in the course remotely or asynchronously. The message is for faculty to be flexible. However, other guidance is that faculty should not make any long-term COVID-related accommodations. Instead, these accommodations need to be determined through DRS. The messaging today seems to put expectations on faculty to be flexible and accommodate all student concerns.
Yeah.
Can you clarify the limits?
I want to clarify that. Yes, a student needs to actually go through the special accommodation request for that. We are not asking unlimited amount of time, because that essentially would mean the entire class becomes asynchronous and also a few people if it's in person. The idea is that the students will follow their own procedures for asking for special accommodations. What we are asking faculty is that following that process, like they would do it before the pandemic, that they would accommodate those individual students who have those specific requests. Again, this is for in-person, the faculty who choose to have in-person classes. It's not a universal blanket for the remainder of the quarter, you accommodate every student in your class. Is that the clarification that we're asking for? Okay.
And I've gotten a few questions about access and availability to the charts and the information that we've referred to today during this. And there will be a follow-up piece after this that has links to all of that information, all of the UW charts, our internal Q&A, all of the resources that we've talked about today will be included in that, including the flow chart around what to do if you have symptoms, if you've been exposed, or if you have a positive test, and how that flows down.
And most of this is available either on the UW Tacoma coronavirus resource page or the University of Washington Seattle coronavirus page. There's lots of information there, including an FAQ for folks who are looking for more information.
Yeah, there is a lot of information available. There's so much, it's actually very difficult to navigate all of it. So we will try to put that in a way that's clear and that has kind of links directly to the resources that are helpful. I find that flow chart, I've actually put it in the signature line on my email so that people have access to it. I find it extremely helpful, and we'll make sure that gets out front and center. Mm-hmm. Well, we've gotten through most of the questions. I have tried to kind of contain them into others. I encourage people to continue to send those questions. I'm sure there will be more. Please keep sending them. I will get all of these questions. I'll put together a Q&A document with these as well, so that if we didn't get to yours during this, we will get to your question. So
I just want to end by saying thank you to everyone who tuned in, who sent questions, and thank you for everyone for your patience, and as we're saying now, grace and compassion for our students, for our staff, for our faculty, and for each other as we are going through this really difficult time. But we are entering a period where we're going to have to live with COVID. And so as a community, what we want to do is try and figure out how we live with it together while keeping each other safe and healthy. So thanks everyone for tuning in.